Ladies and gentlemen, for the first time at our annual meeting, we are pleased to include a panel highlighting the patient perspective and the important role that the patient advocacy community plays in ensuring access to affordable medicine. To introduce our moderator, please welcome the CEO of Aurobindo Pharma USA and AAM board member, Mr. Robert Kennard.
Good afternoon. I have a distinct pleasure to introduce something that is quite unique to the association and our new association. So increasing patient access to more affordable medicine remains a public health priority. But we understand that this is not an issue that any one group can tackle alone. It's critical that we work together to identify areas of common interest, for collaboration, and facilitate greater engagement from everyone who may benefit from the tremendous potential that generic and biosimilar industries can deliver to patients and the healthcare system. Our panelists in this next session will speak to their perceptions of the generic industry, issues that impact their constituencies, access to medicines, and share their thoughts on how that generic and biosimilar industries can build stronger relationships within the patient advocacy community. Our moderator today is Marc Boutin, the Chief Executive Officer of the National Health Council. Under his leadership, the Council has convened a broad range of stakeholders to create and implement pragmatic strategies and public policy that address diverse issues. The needs of the people with chronic conditions, Marc has been actively involved in patient advocacy, organization management, health advocacy, and both federal and state policy throughout his career. He is a founding member of the International Patient-Focused Medicine Development Consortium and has served on the governing board of the International Alliance of Patients Organizations. He also has served on the Humana Cares Clinical Advisory Board, the Community Health Charities Board of Directors, and the North America Advisory Board to Drug Information Association. Please join me in welcoming Marc Boutin.
Thank you. Appreciate it. Good afternoon, everyone. Okay, I know you had a long day. It's nice and warm outside. But I'm going to try and amp up the energy a little bit. Good afternoon, everyone. Okay, you're still only so-so, but we're going to let it go. I'm really pleased to be here today, and I'm really pleased to have you joining us as we talk about harnessing the patient community to support generic access. We're really lucky today to be joined by two powerhouse patient representatives from very prominent organizations that have truly influenced and shaped public policies at all levels of government. I'm going to start by introducing Pam Trachsel. Pam is the Senior Vice President of Alliance Development and Philanthropy for the American Cancer Society Action Network, the advocacy affiliate of the American Cancer Society. Pam is responsible for developing relationships with companies and individuals to help further the fight against cancer. Previously, she served in a variety of roles within the Democratic Party, including the Democratic National Committee, the Democratic Governors Association, and the Democratic Legislative Campaign Committee. She holds a BA from the American University in International Studies and Political Science. Andrew Sperling is the Director of Federal Legislative Advocacy for NAMI, the National Alliance on Mental Illness. In that position, he leads legislative advocacy initiatives in Congress and federal agencies and works on issues affecting mental health community with a focus on improving the lives of people with severe mental illness. Andrew is also the co-chair of the Consortium for Citizens with Disabilities, CDC Housing Task Force. Previously, he was the Deputy Director of the Government Relations for the National Community of Mental Health Care Council and a legislative assistant for U.S. Representative Dick Swett. He has a BA from Tulane University, a master's from Georgetown Washington University, and a law degree from Franklin Pierce Law Center. Now, when people talk about me as a patient advocate, they often say he's high energy, he's very passionate about what he does. What you're going to find are that Pam and Andrew make me look really, really dull. So we're going to have a good conversation. And it's okay to laugh at that. Before we begin, we want to recognize a few of the folks in the audience. We're living in an incredibly complex environment. Success is predicated on all stakeholders coming together to find meaningful solutions to incredibly complex issues. So I'd like to recognize the following organizations and people. If you'd please stand if you're in the audience. Carolyn Eldridge, President and Founder, Prevent Cancer Foundation. Crawford Clay, Certified Patient Support Navigator and Advocacy Coordinator, Colon Cancer Alliance. George Dahlman, Executive Director, Children's Cause for Cancer Advocacy. Lisa Hughes, Director of Strategic Partnerships and Projects, National Patient Advocate Foundation. Maureen Jaffa, Director of Regulatory Policy, Faster Cures. And a person who's been on the same traveling tour as me, Mary McGowan, CEO, Women Heart. And many of you have probably seen her on TV recently promoting her cause. I want to take a few minutes and just give you a little bit of background on the National Health Council. We are an umbrella organization of patient advocacy organizations, many of the groups just listed. We have been in effect since 1920. We provide a united voice for people with chronic disease and disabilities. The patient organizations include all those you would recognize, like American Cancer, American Heart, but also organizations representing rare, ultra-rare, and less prevalent conditions. We work primarily to promote two things: access to treatments and interventions, certainly generic products, and to make interventions better, to ensure that all people have effective interventions for their diseases and